We'll go to another journalist. We will come back to Carl later on. Naomi Kress from Bloomberg News. Naomi, can you hear me? Naomi, can you hear me?
Hi, this is Naomi. Yes, can you hear me?
Yes, very well. Please go ahead.
Hi. Thanks. So I'm wondering, why have the numbers of COVID deaths in Europe remained so relatively low, even as cases increase? Has something changed about the virus, or has something significant changed about how doctors are responding to the virus? Or if this is just demographics of young people being infected instead of old people? What has changed to keep the virus out of these older and more vulnerable populations? Thanks.
Thank you, Naomi. Maria?
Yes, thank you very much for the question. It's a good one. You partly answered it with the way that you asked the question yourself. It's a combination of factors, we think. And being 8 months into a pandemic, we know so much more about this virus than we did in the beginning. So much more about how to find cases earlier, how to provide clinical care for cases depending on the severity. We know that early intervention at the first point of entry, someone is identified as a case. That early action in checking their oxygen saturation level, providing oxygen where necessary, admitting them to hospital to provide symptomatic care, providing respiratory support when needed, dexamethasone if they are in a severe state or critical state, that will save lives. But in addition to that, we are in a better position to prevent the virus from infecting vulnerable populations. We know that individuals of older age, individuals who are over 60 and older, people with underlying conditions are at a higher risk of developing severe disease and at a higher risk of dying. And if we could prevent that from happening, then we can reduce deaths. So we've heard from a number of countries, when the virus enters a long-term living facility, for example, it could have devastating effects and have high mortality. And in many situations, in many countries, that is being prevented now. We're preventing the virus from actually entering that type of facility. And if we could prevent that, then we could prevent deaths. And so it's a number of factors. If we can find cases earlier, we could provide earlier care. If we could prevent amplification events in vulnerable populations, that will also save lives. But the last thing to mention is we are seeing, as countries are opening up, in many situations, countries have been successful in controlling transmission, but as they open their societies up, we're starting to see some resurgence in some areas, and that resurgence is largely happening in places where people congregate. And in some countries, that's happening among younger populations. We've heard about outbreaks that are happening in nightclubs, for example, in entertainment industries, in different types of social events, and that tends to be younger individuals. So we are seeing a shift in the age demographic of individuals being infected. And that is to be expected somewhat, because in the beginning of any epidemic, any pandemic, your surveillance tends to focus on severe patients, because that's what the system is set for. And as your testing capacity increases, your surveillance expands, you find people on the more mild end of the spectrum. And those tend to be younger individuals without comorbid conditions. And so that will change the picture of mortality that is happening. But I do think we need to be careful. Even though we are seeing a reduction in mortality because we have tools that are in place, we still don't know the long-term effects of this virus. So even individuals who have mild disease, we are learning about some individuals who are having some long-term effects. And I think we just need to focus on still saving lives, as many lives as we can, but we also need to focus on preventing infections. And we do have tools in place that can do that.
Thank you, Maria. Now we are moving to